We all love the look and convenience of lash extensions. Who doesn't want to wake up in the morning and need no makeup? But what are the risks of lash extensions? Are they really safe? Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 4 p.m. Hello there, I'm Dr. D. I'm a doctor of optometry with my own private practice. I did a residency in ocular disease and I specialize in dry eye. On this channel, I post educational videos about eye health as well as vision products. If you're new here, please consider subscribing, hitting that bell down below so you never miss a video. During today's video, feel free to check out the notes down below. I've left some helpful tips and information, some resources if you're considering getting lash extensions, and you can check that all out down below. So today I'm going to be talking about the risks of eyelash extensions. We're going to talk a little bit about lash extensions themselves and the different kinds. I'm going to go into my 7 concerns about lash extensions, and then we're going to talk about some better alternatives to lash extensions that still make your eyes and your eyelashes look great and really pop. Okay, my peoples, let's go to eye school. So today we're talking about lash extensions, and there are many different kinds, but they all tend to be synthetic material, and they can be attached to your eyelashes in different ways, but most commonly using an adhesive or glue. Now there's different types of lash extensions. There's the kind where the lashes are individually glued to each individual lash, and those last much, much longer than the type of extensions which we would call like falsies that come in a strip form. In terms of how those are used, however, you're still using a glue for each type of extension. So one of my biggest concerns about the use of falsies or the use of extensions is in one Japanese study, over 26% of those who had lash extensions had suffered adverse or unintended consequences of having those lashes present. So here's my 7 concerns about lash extensions. Number 1, the application process itself. Many times sharp tools are used during the application process, and if you're not having them done by an experienced lash technician, it's very possible to have your cornea scratched, to inadvertently have one of those sharp tools kind of, have trauma to your eye basically. So this is kind of lower on the list of concerns, but it is certainly feasible that something like that could happen during the application process. Another interesting thing about the application process for lashes is that the technician normally has to secure the lashes on your lower lid when they work with the upper lid. Now, I had lashes done in the past, and when they secured my lower lid, the tape or paper that they used was actually in contact with my eye the entire time the lashes were being applied. And so when I got home, I was very red and irritated in that area. So make sure you know that and you let your lash technician know if you have that paper in contact with your eye. So these are all things that can happen during the application process. My second concern, and one of the biggest ones, is all about the adhesive. So the glue that is used is very concerning. Many times this glue contains formaldehyde. If you're not familiar, formaldehyde is used to embalm dead bodies. Gross, not safe for your eyes. That does not make me happy or comfortable. And in the case of lash extensions that stay in place for a month or more at a time, that formaldehyde is going to be kind of permanently in your lash area. All right, the third concern I have is lash fallout over time. So this process can be sort of damaging to your lashes. You can have lashes that break off. You can also have lash fallout over time. So from having these lashes glued and the weight of them and the chemicals involved with the adhesive, it's very possible for lashes to just fall out and lash follicles to actually be harmed and no longer produce lashes anymore. So here you go in wanting bigger, fuller, more beautiful lashes, and the process itself can take lashes away from you. One of the most important things when it comes to lash fallout is to make sure not to tug or rub at your eyes a lot with those lashes in. That's going to be more damaging to the follicle itself. All right, my fourth concern around lash extensions is the fact that they can hide other issues. So if you have blepharitis, which is an accumulation of dead skin cells and debris at the base of the lashes, or if you have a Demodex mite infestation within your lash follicles, having lashes, false lashes present can actually mask those problems. So me personally, whenever I'm examining eyes that have false lashes on, it can be very, very difficult to see all the way down to that follicle, all the way down to the root of the lash, and really ascertain what's going on with the person's lid margin. So just keep in mind that it can make it very, very difficult for your doctor to see what's actually happening at your lashes, lash margin. All right, my fifth concern really revolves around the fact that these lash extensions completely change your lid dynamics. What do I mean by that? So most of us think that when we blink, our eyelids just sort of go like this, like up and down, just straight up and down. That's not actually true. The lid blink dynamic is really, really interesting. There's kind of a lateral motion of the lower lid, and then the top lid sort of zippers down and spreads tears across the ocular surface toward your tear duct right here. When you put a heavy false lash on your lashes, number one, you're changing the length of your lashes, which I know is the goal. But that changes the whole lid dynamic. It changes the physics of the way that your lid is able to blink. It can also create a wind tunnel effect and kind of shuttle more air toward your ocular surface, which is very, very drying. And the weight of the lashes changes as well. And so you may not have a complete blink. I've noticed in my patients with lashes, false lashes, that their blinks are not as complete as they should be. All of this is going to contribute to your ocular surface not having the proper tear composition and becoming potentially dry and inflamed and therefore symptomatic to you. All right, my sixth concern is around the lash remover chemicals. So they have to use chemicals that can also be abrasive to get the lashes off, and those are also not good for your eyes. And then my final concern, and again, this is one of the biggest ones as well, lies around the things specifically that can happen to your eye. Swollen eyelids, inflamed eyelids, redness, eczema from a sustained allergic reaction, a contact dermatitis from the glue in the lashes, a corneal abrasion, a lash that becomes dislodged and with that blink hits your cornea and causes an abrasion, and then that puts you at risk for a keratitis or an eye infection. All of those eye concerns are really up there for me as well, even though I mentioned them last. Last is not least. Those are a big, big deal. So yeah, just to sum up point number 7, the ocular conditions that can occur, you can have bloodshot eyes, burning, itching, pain, rashes around your eyelids, redness, inflammation, and swelling, all from lash extensions. Now, I've mentioned it in other videos before, but we know in dry eye what is around your eye will end up in your eye, and so that's why it's so very important to be very cognizant of what we put around our eyes and try to make those products be as gentle and sensitive as possible. So let's talk about a better way to get those long, luscious, thick eyelashes that you're wanting. So number 1, I'm gonna recommend a gentle eye doctor approved makeup. My preference is Eyes Are the Story. If you've never heard of them, it's a brand that was developed by an eye doctor. I did an entire video on it up here. So it was an eye doctor in conjunction with a member of TFOS, so Tear Film and Ocular Surface Society. and they are the ones that produce the DEWS report or the dry eye workshop report. So really nobody more respected in the field of dry eye. And literally folks from that group came up with this makeup. And so it is free of all chemicals. It is very, very good for sensitive eyes. I've been wearing it exclusively since that unboxing. And my first recommendation is to go with a makeup like that. It's really, really healthy for your eyes. Okay, it might not be as thick as lash extensions, but it's going to work to keep your lid margin healthy, your lashes healthy, and that's gonna promote them being nice and full and long just naturally. The second thing I would recommend is another gentle eye doctor approved serum. So one of my favorites is made by Ocusoft. It's called Zoria. I will link it down below. I believe it's available on Amazon. But Zoria is a wonderful serum. You apply it to your upper eyelids. It works much like a prescription Latisse would. It helps the lashes grow. It's a formula that's been proven. We can show you some before and after shots from Zoria's marketing, but it does a really, really good job of lengthening lashes naturally. Which brings me to my next type of lash lengthener, the prescription version. That's gonna be your Latisse. Now you'll have to see your eye doctor to get that prescription, but it's certainly a viable option. Latisse is derived from a glaucoma drop that had the side effect of lengthening lashes. It does a really, really good job. For most people, it is just fine in terms of comfort. It doesn't cause any adverse effects, but you'll want to talk to your doctor about the side effects because it can sort of darken the skin around the eyes, the eye itself. And then fourth of all, I'm gonna admit that we are all human and we like to look and feel pretty, and there will be times when lash extensions are okay. You just have to sometimes, you know, have a special occasion. And if you don't believe me, I'm gonna show you some pictures from my wedding and some photo shoots we did. And I had false lashes in both of these photos, and my eyes came out on the other side just fine. As long as you know the risks and you use them very, very sparingly, and you let your eye doctor know right away if you're having any of, you know, the things I talked about, I think lash extension wear on a very occasional basis, I can understand. Thus concludes iSchool for today. Your lesson is over. I want to thank you for joining in. Make sure to like and subscribe so you never miss a video. We post them every Wednesday at 4 o'clock. We'll see you next time.